Welcome to the MI Mental podcast. My name is Dr. Sabine Fonderson, and in this podcast, we explore real life cases involving medical professionals and their encounters with the legal system. Today's episode is part of my Doctors in Court edition, and we'll be diving into a disciplinary case that raises important questions about professional ethics, patient care, and medical decision making in psychiatry. In this episode, I'll explore the case of a psychiatrist who faced accusations from a former patient. I'll walk through the timeline of events, the patient's complaints, the defense presented by the psychiatrist, and the final ruling by the disciplinary board. As always, I'll be using fictional names to protect the privacy of those involved, but the details are based on real events. And by the end of this episode, I'll leave you with two questions to reflect on. So let's dive right in. Let's start by breaking down the key events that led to the formal complaint. In 2000, our patient Laura first visited a psychologist due to marital problems. She had a history of depressive symptoms and was prescribed the antidepressant Seroquel. In 2004, Laura went through a divorce which exacerbated her mental health issues. She began living with a new partner the following year. Now, in November 2005, Laura was seen by the crisis service after experiencing delusions. She believed a bank's computer system was going to collapse. She was diagnosed with a bipolar disorder featuring a severe manic episode with psychotic features. Between May 26th and July 24th, 2006, Laura was voluntarily admitted to a psychiatric hospital due to a manic episode. During her stay, she was under the care of Dr. John, who is the psychiatrist in this case, and he was responsible for her treatment. She was diagnosed with a bipolar 1 disorder and psychosis. And upon discharge, she was prescribed medications, including lithium, and was scheduled for follow-up at a lithium clinic. On December 27th, 2006, Laura was involved in an incident of arson and was taken into custody by the police. The crisis service was called, and Laura was placed under involuntary psychiatric care due to her psychotic state. The emergency psychiatric team, led by Dr. John at the time again, reviewed her case. A month later, in January 2007, during her stay in the psychiatric ward, Laura continued to refuse antipsychotic medications, which she felt were unnecessary. Her psychosis, characterized by delusions such as being pregnant by immaculate conception, persisted. In March 2007, Laura requested to be discharged from the psychiatric ward, but Dr. John and his team denied this request, citing her ongoing psychotic symptoms and refusal to take medication. These events set the stage for the formal complaint filed by Laura against Dr. John in late 2007. Now let's explore the specifics of Laura's accusations. Laura made three primary accusations against Dr. John. Number one, failure to act independently. According to Laura, she accused Dr. John of not making an independent diagnosis and merely parroting the opinions of his colleagues. She believed that Dr. John had simply followed the treatment plan set by others and had not considered her case objectively. Number two, coercion and bias. Laura claimed that Dr. John had coerced her into staying in the psychiatric ward by supporting the continuation of her involuntary commitment. She argued that Dr. John was biased because he was too involved with the psychiatric hospital where she had been previously treated. Laura believed he was unable to provide an impartial judgment. Number three, involuntary treatment. Laura also objected to the forced administration of antipsychotic medications during her stay in the hospital. She argued that she was capable of making her own decisions and her refusal to take these medications should have been respected. These accusations formed the core of Laura's case against Dr. John, as she sought accountability for what she felt was an unjust and coercive treatment. Now, let's take a look at how Dr. John defended himself against these accusations. Now, remember, Dr. John is the fictional name of the psychiatrist in this case. Independent assessment. Dr. John argued that his diagnosis of Laura's bipolar 1 disorder with psychotic features was based on a thorough review of her medical records, discussions with her previous psychiatrist, and his own direct observations. He noted that Laura's symptoms, which included grandiose delusions and refusal to acknowledge her condition, were consistent with a severe manic episode. Dr. John emphasized that while he consulted his colleagues, His decisions were based on his independent judgment. Support for continued care. Regarding the accusation of coercion, Dr. John explained that Laura's mental state at the time of her hospitalization posed a significant risk to both herself and to others. He highlighted the arson incident as evidence of her deteriorating condition and argued that her involuntary commitment was necessary to ensure her safety. Dr. John maintained that his decision to support her continued stay in the psychiatric ward was based on her ongoing psychosis and refusal to accept treatment. Use of antipsychotic medications. Dr. John defended the use of antipsychotic medications, explaining that Laura's refusal to take them was a barrier to her recovery. He noted that while Laura was entitled to express her preferences, her lack of insight into her illness made it necessary to administer medication involuntarily to stabilize her condition. Dr. John argued that the medication was in Laura's best interest and her improved condition after treatment supported his decision. Dr. John's defense was centered on the argument that his actions were consistent with psychiatric standards and were in Laura's best interest. Let's move on to the findings of the disciplinary board. Number 1, independent assessment. The board found no evidence to support Laura's claim that Dr. John had simply followed the opinions of others without making his own assessments. The board noted that Dr. John had reviewed her records, conducted his own evaluations, and made an informed diagnosis. His reliance on previous medical history was appropriate given the complexity of her condition. Number 2, support for continued care. The board determined that Dr. John's decision to support Laura's continued involuntary hospitalization was justified based on her mental state. The arson incident, combined with her persistent delusions, indicated that Laura was not in a condition to make rational decisions about her care. The board concluded that Dr. John had acted within the bounds of professional responsibility to ensure Laura's safety. Number 3, involuntary treatment. The board supported Dr. John's use of antipsychotic medications, noting that Laura's refusal to take them was part of her psychotic condition. The board emphasized that when patients lack insight into their illness, involuntary treatment may be necessary to prevent harm. The improvements in Laura's condition following the administration of medication further validated Dr. John's decision. The final ruling. The board ruled that Laura's complaints were unfounded and the case was dismissed. The board concluded that Dr. John had acted professionally and ethically throughout his care of Laura. Let's take a moment to explain some key medical terms involved in this case. Bipolar 1 disorder with psychotic features. This is a severe form of bipolar disorder where individuals experience extreme mood swings, including manic episodes that can involve delusions or hallucinations. In Laura's case, these delusions included grandiose ideas and religious beliefs. Involuntary commitment. This is a legal process used to hospitalize individuals who are deemed a danger to themselves or others due to their mental illness. In Laura's case, her psychosis and the arson incident prompted her involuntary hospitalization. Antipsychotic medications. These drugs are used to manage psychosis by altering chemical balances in the brain. In this case, Laura was resistant to antipsychotics, but they were administered involuntarily to treat her psychosis. And these concepts are critical to understanding why certain medical and legal decisions were made in Laura's case. Before we wrap up today's episode, I want to leave you with 2 questions to reflect on. How can doctors ensure they are respecting patient autonomy while also acting in the patient's best interest when mental illness is involved? Doctors must carefully balance respect for patient autonomy with their duty to protect patients who may lack the capacity to make informed decisions. Clear communication, showing empathy, and ensuring that decisions are based on the patient's safety are essential in navigating the ethical dilemmas. Question number 2. When is it appropriate for doctors to use involuntary treatment, and how should they approach patients who resist treatment? Involuntary treatment is appropriate when a patient's mental state presents a risk to their safety or the safety of others. However, doctors should always strive to explain the rationale behind treatment and seek to involve the patient in the decision-making process as much as possible, even in difficult circumstances. Thanks for joining me today on this in-depth discussion of psychiatric care and the ethical challenges doctors face in court. If you enjoyed this episode, be sure to subscribe and tune in for more cases on the MI Mental podcast. Until next time.